Professor Azzolini asked me to actually try to give a voice to other professions in the healthcare ecosystem that are maybe less heralded than the physicians. And this is actually what we're trying to do. So they're all pillars that are building the same house. And we believe that these new technologies could and should be provided to all these professions. Around half of the healthcare operators, for example, in a system or in a hospital, are nurses. They also need to think about the overall holistic well-being of the patients themselves. Not only there is this structural moment in which the nurses are, holding like a huge amount of responsibility, but there is also like a shift that is happening in our societies. There is this shift in the healthcare system from acute to chronic patients. So not try to come back to the original situation where we were fully healthy, but to actually manage what is the chronic life that many people need to live with. And also nurses that will see their role in a way increased, but also made it harder because obviously more responsibility will fall on their shoulders. You need to circularly assess the health of this patient on and on again. And it's the same UN, actually, it's the same Director General that said that nurses are actually the backbone of the healthcare system. And so we just need to make sure that their job is facilitated by new technologies and that their capabilities and competences are actually included in these new technological tools. It's not only a question of health outcome, that obviously is the most important thing when we talk about healthcare, but it also brings with them a lot of significant savings, financial savings to the system. What we are trying to do is actually trying to create instruments that are capable of being addressed by these new technologies, because a key problem that we find with the nursing is like it's a very all-encompassing, holistic type of competence, and this competence it's difficult to enclose in a technological tool. They are trying to achieve like a language, a taxonomy that can actually be used and be standardized across all the settings in which they operate. And they're also trying to create functional health patterns that are able to scientifically analyze the care and the health of a patient.
And thank you for that lovely insight into nursing. Nursing is a role, but also a credential. And the credentialing, as we're talking about different skill acquisition and ensuring that the skills are up to keep, those can vary, obviously, country to country, depending on the credentialing processes from different countries. What sort of vision do you have for the credentialing or the assurance of these skills acquisition sort of during training or on the go, and how can we account for different country variants?
We find that we need to address this problem from both directions. So on one side, we need to create like a nursing education that is as much as possible similar. So that's the first angle. The second angle is on-job kind of training